If a loved one is suffering from unbearable pain that even the strongest medications can't cope with, you still have a way to help. It's a spinal pain neurostimulator, Pain Fighter. This device helps to relieve the patient of the suffering that other means can no longer cope with. Installing this stimulator is a less known but quite effective method, which has been used successfully in leading neurological centers and hospitals in Turkey. Today we will visit one of these Turkish hospitals and meet a doctor who receives patients from other countries. He will answer our questions and tell us what the thing is, a spinal pain neurostimulator. Watch the video to the end, and if you're interested, do subscribe to us on our YouTube channel. And here in this Instagram we have a lot of useful information about medical care for foreigners in Turkey. Severe constant pain accompanies many heart diseases. Cancer, diabetes, circulatory disorders, pain after loss of limbs. It is not always possible to overcome the pain with medication. For example, in the late stages of cancer, metastases grow into adjacent organs and tissues, affecting the nerve endings. Doctors are forced to constantly increase the dosage of painkillers. However, the side effects of painkiller usage can become almost more of a problem than the pain itself. Addiction, liver damage, allergies, asthma, seizures, and so on, up to and including death in the event of an overdose. The study of ways to combat pain is engaged in a special field of medicine, algology. The name comes from the Greek words algos, pain, and logos, science, knowledge. A few years ago, algology enriched the arsenal of doctors with a device, the use of which has become one of the breakthrough methods to soothe excruciating constant pain. It's a neuroblocker that uses a technique called spinal cord stimulation, or SCS for short. An electrode is implanted in the spine, which delivers electrical impulses into the epidural space, the area between the spinal cord sheath and the vertebral body. The impulses activate neurons that inhibit pain signals traveling from the body parts to the brain. In the first stage, during test stimulation, the electrodes are taken outside and connected to an external stimulator to match the parameters and assess the effectiveness for the individual patient. Then the neurostimulator is connected to a permanent battery to create a permanently functional system. So the neurostimulator doesn't treat the cause of the pain, but it does relieve the patient of their pain. It's an adjunctive device. Sometimes the pain can be relieved almost 100%. With the use of a neuroblocker, more than 70% of the pain usually goes away in patients with lower back problems. Up to 90% of the pain disappears in patients with coronary artery disease, that is, due to circulatory disorders. Dr. Mert Akbaş, professor of algology at Akdeniz University in Antalya. He studied in Istanbul and interned in the USA. He's the only Turkish board member of the World Institute of Pain. He works in his own clinic in Antalya and occasionally teaches in Budapest, where his two twin sons study. Professor Akbaş explained in detail to the Healthy Turkiye team what a pain blocker is and how and in what cases the device is used. So, tell us, which patients can be fitted with a spinal pain neurostimulator? A neuroblocker is mainly used for the following groups of patients. These are people after back or neck surgery, after which the pain has not disappeared and has become chronic. Another option of the most effective uses area. In patients with pain of ischemic origin, i.e., when there are circulatory disturbances in the blood vessels. In addition, the use of neuroblockers is very effective for patients who suffer with neuropathic pain. That is, when the pain originates in the nerve endings and doesn't go away properly. For example, people with diabetes, or people who have had an arm or leg amputated in an accident. And when they have persistent pain that lasts for years, with the use of a neuroblocker, more than 70% of the pain usually goes away in patients with lower back problems. Up to 90% of the pain disappears in patients with coronary artery disease, that is due to circulatory problems. Can pain be eliminated totally 100% with the use of this neurostimulator? Pain can be alleviated almost 100% with such a device. But it is important to note that there are two steps in the installation and use process. First, there is a trial period, and only then does the permanent systemic process begin. The intensity of the patient's pain can be reduced by a minimum of 50%. And at that level or lower intensity, and even more so if the pain disappears altogether. The patient can comfortably live the rest of their life. The rate of reduction of pain intensity can reach 90% and even more, approaching 100%. But still, because patients have had previous surgical or anatomical problems, the pain can't be totally 100% gone. So our goal is to reduce the patient's feeling of pain by 50% or more. This is a very good ratio for comfort and quality of life. Over 2 decades, the spinal neurostimulator has developed a reputation as a somewhat exclusive way to beat pain. This is partly because of its price, and partly because it is being touted as the last hope of suffering people. But it turns out that even on the Healthy Turkey team, a person has been convinced of the device's effectiveness. 8 years ago, my father-in-law had lung cancer. The disease was in its last stage, and he was suffering a lot, and painkillers were no longer working. Because of the pain, my father-in-law could not even eat. He was losing muscle mass. Oncologists said he had only 6 months to live. He even tried to kill himself several times because of the pain. So, my family and I decided to try the last remedy at the suggestion of a professor of medicine we knew. The medics put a neurostimulator in my father-in-law's spine and taught him how to use it. And it worked. When seizures happen, he used to use a remote control to block his pain himself. And I can say he was able to lead a relatively normal life. He started eating normally again, stopped losing muscle mass, and he had a normal mood. And because of that, he lived another 2.5 years. He had a normal breakfast even on the day he died. He lived normally until the very end because he had managed his pain. Doctor, how much time should a patient spend for pain neurostimulator treatment? How long does the procedure last? As I said, pain neuroblocker treatment is done in 2 stages. First, we place the electrode in the patient and conduct a trial period. This can last from a few days to a few weeks. The insertion itself, which we do in the treatment room, lasts about 45 minutes to an hour. Then, if the patient says that the pain intensity has decreased by at least 50% or more, then within a few days or weeks, we do a second procedure. A part of the device, which we call the battery, is connected to an electrode that we already placed in the body. This procedure takes about 15 minutes only. In as little as half an hour, the treatment is complete. And as I said, pain of a patient can be reduced by over 50%, and the patient can go on with their life as pain-free as possible in that situation. Is anesthesia needed for pain neurostimulator placement, and how long does the patient have to stay in the hospital? Neuroblocker placement is a percutaneous procedure that is almost non-surgical, and it does not require general anesthesia. Only local anesthesia in the area where the device is inserted and relaxing sedation are used. The procedure, which is performed under relaxing sedation, is completely comfortable. After both procedures, the patient can go home the same day. Of course, after we've monitored him for a few hours here in the clinic, the patient can go home immediately and no hospitalization is required. And does treatment with a pain neurostimulator affect the patient's daily life? As I said, the patient can be sent home the same day. Of course, and during the trial period, and during the ongoing systemic process, although no major surgery was performed, but since the device has been implanted in the body, there should be no major physical exertion. A person is allowed only light athletic exercises for a few days. It is necessary to pay attention to loads, not to lift heavy things. Intense sports, of course, should be excluded. But in general, there are no problems with the continuation of normal daily life, and the return to it occurs the same day. Treatment of pain with a spinal neurostimulator is not as widely known as the use of medication painkillers. The reasons are obvious. Admit that swallowing a pill and inserting an electrode into the spine are different approaches in terms of complexity. Of course, the complexity affects the cost as well. Installation of spinal neuroblockers may seem an exclusive method, but every year in the world, neurostimulators are implanted in more than 15,000 people. Turkey has already gained good experience in this regard. Spinal neurostimulator implantation should be performed in a well-equipped clinic, and more importantly, by experienced specialists. In order not to make a mistake with the choice of clinic and doctor, you should consult independent medical professionals. In Turkey, this can be done free of charge in a special service company. Its employees, acting doctors with diplomas and experience in Turkish clinics, they know the specifics of this sphere.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkiye, select the best clinic and doctors for him based on the diagnosis, preferences and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
We know you still have many questions and want more information. So we had a long conversation with our interviewer and toured the entire clinic that is run by him. Here, to our surprise, we even found equipment that we haven't seen in large multi-story hospitals. For example, this MRI machine is designed for people who do not like to be in a confined space. At the same time, it is quite compact, taking up half as much space as a regular ring-shaped scanner. This is almost exclusive and very expensive device. The Healthy Turkiye team has seen all sorts of things, but this is the first time we have seen such a device in a private clinic. But let's return to spinal neurostimulators and ask a few more questions non-specialists can have in mind. Is it noticeable outwardly that a person has a pain neurostimulator? As you already know, this system consists of two components. The electrode is placed inside the spine. So, as you understand, no one can see it. And once the permanent system with the battery is placed on the thigh, when the electrode is connected to the battery, nothing can be seen from the outside. Only the patient himself can feel the battery under the skin if he touches this point with his hand. But it is not visible externally, and the presence of the battery does not create any problems that will affect the comfort and quality of daily life. How does the patient feel the work of the spinal neurostimulator? There are different types of pain batteries. The oldest systems also cause a paresthesia effect on the background of pain suppression. This is a feeling of soft vibration, tingling in the area of the pain center. Patients with blocked pain signals to the brain can feel this vibration. Somebody call it a strange feeling. But some patients do not experience this feeling at all. However, with the new technology's batteries, the device can eliminate pain without causing feelings of anesthesia, freezing, vibration, or any discomfort. If suddenly there are any problems with the device, does the patient have to travel to Turkey, or can they seek help in their own country? There are service providers all over the world who can manage such a system. In case of a problem, you can easily contact these professionals and reconfigure the system using the program. Regardless of your location, they can now connect to the device remotely and change the settings of the neuroblocker. But of course, the occurrence of serious problems cannot be completely ruled out. If a person were to have an accident or become seriously ill, if the neuroblocker is displaced in the body, then it may be necessary to see a specialist. But otherwise, there is no need to go to a doctor for help, or even more so to go to another city. And what is the lifespan of the device? How often does it need to be replaced? In general, modern neuroblockers have a much longer lifespan than before. It is claimed that the new systems can work for up to 20 years. Already now we really see that devices created with the latest technology continue to work for more than 10 years. In fact, the work duration depends entirely on the specifics of the patient, on the mode of use. Sometimes patients can increase the power consumption of the device. So, on average, the neurostimulator lasts from 5 to 15 years. This is a system that may need to be replaced after a certain period of time. But when the battery runs out and the device needs to be replaced, removing and reinserting the pain blocker is a procedure that can be done in as little as 15 minutes under local anesthesia. As you can see, new medical technologies make it possible to deal with problems that previously had almost no solution. And it is relatively easy, almost painless, if you allow me that figure of speech. In many complex cases, when pain cannot be defeated by conventional methods, a neuroblocker or pain battery can be almost the only salvation from agony. For consultation, you can contact this phone number on the screen or via chat on the company's website. The website address is on your screen too. There is a lot of information on other health tourism types there. Another source of knowledge about health tourism in Turkey is the Instagram Healthy Turkiye. You can subscribe using this QR code or through the link in the description. If you like today's issue, please give it a like and subscribe to see more videos about medical tourism in Turkey.